I look at aging easily divided into three categories: volume loss, gravity, and skin aging. And I think if we can divide it into these three categories, we can better understand what each part does to help a person look more rejuvenated. Let's start with volume loss. So what I'm going to talk about really is the power of facial fat grafting. Fat grafting around the eyes, particularly, can make the eyes look so much younger, and especially in combination with blepharoplasty, that is removing a little bit of skin, possibly taking a little bit of a fat bag out, and possibly a brow lift as well, depending on the patient. So I sort of lump all of that volume loss into this category, including blepharoplasty, to have you understand that volume loss, where we become bonier and bonier around the eyes principally, and sometimes around the mouth and around the outer face, can be a component of the aging process that's very, very important to address. The second component is gravity, and gravity really affects the lower 2/3 of the face as well as the neck and jawline. And so I perform a deep plane facelift, occasionally a deep neck lift, which is to improve some of the fullness in the neck area as well. And this really helps with the sagging component of this area that really can't be matched with anything non-surgical. The types of energy devices and thread lifts and things like that do not actually have very much benefit whatsoever compared to a deep plane facelift, which really allows you to get great results. The deep plane facelift I perform is a release of these little ligaments that allow a very natural elevation and a very long-lasting result. And you can see that from all angles. The final category is skin aging. And a lot of times when we think about skin aging, we think about lasers and peels, which I perform lasers for patients, particularly around the eyes and around the mouth. However, I think in a lot of cases, the aging process requires other little things that make a bigger difference, and in my opinion, a much smaller recovery period, and that are very long lasting as well. So I perform regular Botox of the upper third of the face, and this truly helps with reducing wrinkles in a way that does not require ongoing therapy, where you could actually progressively need less over time because the skin continues to heal. For the lower 2/3 of the face, I perform what's called meso-Botox, which really allows the skin texture, pores, tone, quality of skin to improve as well, but it doesn't address the wrinkles. So I use dynamic fillers that help complement Botox to help with the creases around the mouth, around the eyes, especially when you're looking and you're seeing smile lines that go down all the way down the face, which Botox simply can't address. So we can't forget the skin. And if you think about the whole, everything put together, you can understand volume loss, gravity, and skin aging are the three major components of the aging process that in combination makes the best results when combined.